The RCN has suspended strike action to consider proposals made by our new Health Minister Robin Swann to restore pay parity with the NHS in England and a framework to take forward the much needed action on safe staffing. As members, you are now being given the opportunity to vote on whether to accept these proposals. The RCN and other trade unions have produced a joint consultation document which outlines clearly what the offer is in relation to pay and safe staffing. As you know, safe staffing was a major issue of concern for the Royal College of Nursing, and we have tried to outline clearly to you in an additional document what the framework proposals mean. Please consider the information you receive and please use your vote. Thank you.
Following negotiations with the trade unions, the Minister for Health has now endorsed proposals to bring about pay parity with the NHS in England for staff in Northern Ireland. What this means is that all staff who are on Agenda for Change terms and conditions will have the same pay rates as their colleagues in England for the years 2019-20 and 2020-21. The pay award for 2019-20 will be backdated to the 1st of April 2019, and the pay award for 2020-21 will be implemented from the 1st of April this year. In addition to the pay proposals, there will be a refresh to the pay structure that will mirror the changes that have happened for Agenda for Change staff in NHS England. This includes the removal of incremental points, which will result in some staff moving to the top of their band more quickly and will improve starting salaries for staff who join the NHS. If accepted, the Northern Ireland Executive have made a commitment to ensuring that back pay should be received by all staff in their April 2020 pay at the latest. Each member will have an individual pay journey, and to assist you to understand how this pay proposal affects you, we've agreed with the Department of Health that they have developed a pay calculator which is housed on the Department of Health website. We would encourage all staff to look at this calculator to understand what these pay proposals mean for you personally.
There are currently around 2,800 unfilled nursing posts across the health service, and it's estimated there's a similar level in nursing homes. As you know, the shortage of nursing staff has had a direct impact on your patients, resulting in long waiting lists and times, difficulty in accessing services, and nursing staff being unable to provide the level of care to patients and families that they would like to. The RCN had been able to get pay negotiations going, but it was very difficult to get safe staffing onto anyone's agenda. As you know, that was one of the reasons for our strike action. When we finally got a new Health Minister, we were able to begin these discussions. After intense negotiations, the Health Minister has endorsed a safe staffing framework. Ministerial endorsement is important as it means we can hold the Department of Health to account. Moving forward, both the Department of Health and the trade unions will work together with you to meet the safe staffing challenges and opportunities presented through this framework. As part of our consultation with you, you will receive additional written information which outlines the areas covered by safe staffing and what this will mean for nursing staff. This video will give you the main headlines. So, what did the RCN ask for and what did we achieve? In 2016, a task force report on the state of nursing and midwifery was commissioned by the then Health Minister. This report is important as it contains evidence and supports the many concerns that the RCN have raised over the past decade, including concerns around lack of safe staffing, recruitment, retention, banding and pay. The report had been completed but had not been published. RCN requested that it be published immediately, and a costed implementation plan to deliver on the recommendations was put in place. Next, the RCN asked for the full implementation and funding of all completed phases of the Delivering Care Policy Framework. This is the tool that we as nurses have agreed allows us to work out how many nurses and nursing assistants we need to deliver safe care. RCN wanted to go further, however, than policy framework. We want safe staffing to be law. So we also asked for a case to be developed and the Assembly to consider creating safe nurse staffing legislation. And this is what we have achieved. Due to the high number of registered nurse vacancies, the RCN asked for a fully funded increase in commissioned pre-registration nursing student places of 500 per year over a 5-year period. The Department has committed to increase places by 300 per year over the next 3 years. While this is short of what we ask for, we also understand that there are currently issues around supporting quality nursing placements. The RCN will continue to monitor the situation, and if we believe there is scope within the system to increase these places further, we will bring pressure back to the Department of Health. The RCN have been raising concerns over a number of years that the post-registration nursing and midwifery budget had been decreasing year on year. We ask that this budget be restored to at least its previous highest level. The Department has agreed to fund this increase in full. The RCN ask for a firm commitment to ensure that nursing is represented at the top table in all discussions and decisions on HSC transformation. Nothing about us without us. The Chief Nurse sits at the highest level committees. She has committed to working through her Nursing Advisory Committee to ensure nursing is represented at all relevant discussions. The RCN also asked for a firm commitment not to implement any nursing recruitment freezes within Northern Ireland until all nursing and midwifery vacancies had been filled. This has been agreed. Finally, the Health and Social Care Workforce Strategy 2026 is a Department of Health document. This document looks at many issues such as recruitment and retention of staff, high quality training and development, effective workforce planning, recognising the contribution of the workforce and enabling a work-life balance. The RCN asked for this strategy to be fully costed and for an implementation plan to be delivered without delay. The Department of Health has committed to an urgent schedule of discussions to develop a costed action plan for this to happen. This framework on safe staffing will take time, but it is a positive step in both recognising the seriousness of the situation and in the commitment to address the many issues that impact on nurse staffing.
As the Director in Northern Ireland, I'm incredibly proud of the determination and commitment by RCN members, which has got us to this point in our dispute. It was never an easy decision to take strike action, but nurses and nursing assistants have truly shown their determination to ensure that patients in Northern Ireland receive the care they deserve and that staff are treated equally and paid equally. RCN members will receive full information through a consultative ballot that you will receive through your email. If you don't have an email address, the RCN will post this out to you. Please ensure you look at the information carefully and please use your vote. This is your opportunity to have your say and to ensure that the voice of nursing is used and heard.